Europe for the last 30 years has been telling us stop doing knee replacement, stop doing Achilles or plantar fascial surgery, you're destroying the structure and function of the foot. But we don't want to do that because the insurance companies don't want to pay for it. So they term it experimental and they don't cover it. But instead of having a knee replacement, you can have one shot of organs or one shot of exosomes, and it can rebuild an entire knee in 6 months. It can resurface the cartilage, repair the meniscus, tighten the capsule, change out that arthritic fluid. I'll inject somebody's knee and tell them, you'll start feeling better in 2 weeks, I'll see you in 6 weeks. Inevitably, they'll come back in 6 weeks going, I'm 80, 90% better. Why did the doctor tell me I need a knee replacement? Because nobody practices regen med. It's not covered by insurance. So if you want to go through 6 months of rehab and a year of surgery and rehab, that's covered by insurance. If you want regenerative medicine, there's about 12 of us in the United States that specialize in what I do. But today we're going to talk about heel pain. And what I really love is heel pain, whether it be plantar fasciitis or Achilles tendonitis, two of the biggest ones. Plantar fasciitis is pain on the bottom of the heel, first thing in the morning whenever you get up out of bed, after periods of exercise. After a short period of rest, you go to stand up, your pain's back. Or Achilles tendonitis, which is pain in the back of the heel, and that's usually brought on by initiating any type of exercise, and then you'll get the same. You get the pain in the back after periods of rest or overexertion without proper stretching. So basically, plantar fascia, it's a band of tissue that goes from the heel to the toes on the bottom of the foot. And so on the bottom of our foot, we have a layer of skin, a layer of fat, a little thicker under the heel, a little thicker under the metatarsal heads. The long bones are called metatarsals. And then a band of tissue that comes off of the heel bone right here and then widens out and goes towards the toes. That band of tissue is called your plantar fascia, and that's our foot's shock absorber. So whenever you have pain on the bottom of the foot, it's because there is damage to the bottom tissue, that plantar fascia. It is beginning to tear itself away from the heel. And the same thing with the Achilles tendon that comes down and inserts into the back of the calcaneus, the heel bone. As it begins to overstretch, it starts to tear itself away from the heel, and slowly, as these two areas are pulling themselves away from the heel, go ahead and switch those photos so you can. So basically, Achilles tendonitis, if you look, is right in the back over here, pain first thing, and then plantar fasciitis is on the bottom. So go ahead and switch to the next one. Questions and answers, you guys can ask anytime you want. Otherwise, wait till the end, or I don't care. I'm pretty lax about everything. Go ahead to the next one. So plantar fasciitis, again, is going to be pain that's centered right on the bottom of the heel itself. And that's from a tearing away. And go ahead to the next one. So here we are. Here's our band of tissue that is on the bottom of our foot. And this is where everything is beginning to tear away from it. You see this little thing, it looks like a little bit of a heel spur. And that's because as this band is pulling away from the bone, or this band, the Achilles tendon, is pulling upwards because it's being overstretched, it begins to very slowly start pulling itself away from the bone. And as it's doing that, it's pulling the protective tissue off of the bone, which is called a periosteum, which is a thin fibrous tissue that covers every bone in our body. And as you pull that periosteum off of the bone, it does two things. One, it leaves a little open space. The body doesn't like to have open spaces, so it lays down bone, you get what looks like a spur. But that spur does not hurt. So whenever you go to a doctor and they tell you, oh, you got heel spurs, that's the issue. That's not the issue. That is just secondary to what's going on. This band of tissue is over tightening and pulling away from the heel, and it's causing that open space, which is causing that bone to lay down, and you get that heel spur. But that's not what's causing the pain. The pain is coming from whenever you pull that tissue off of that bone, you are tearing the little arteries that are feeding that band its nutrients. And as you tear those little arteries, that band begins to starve for nutrition. And that starvation of that band of tissue leads to it to begin to dry up. That drying up is called calcification. And as that band begins to calcify, it loses its flexibility. And then it begins to get thicker. And as that band begins to calcify, there is a nerve that goes beneath the bottom of the heel called the infracalcaneal nerve, or Baxter's nerve, that some people know the name of. And as that calcification, that rust pocket, I like to call it, the plantar fascia, which is your foot shock absorber, is rusting. And as that rust pocket gets bad, it puts pressure on that nerve, and that's what causes people pain. So whenever they come into the office and they go, yep, I got plantar fasciitis, You've had plantar fasciitis for 20 years from the size of that heel spur. Oh no, I've only had the pain for 3 days. I get that. The heel spur doesn't hurt. But you have infracalcaneal neuritis, inflammation of that nerve from that calcification, from that rust pocket impinging on it. And it's the same thing when it comes to the Achilles tendon. Go ahead to that next slide. I think we have Achilles tendon. So the Achilles tendon, which is coming down here, begins to pull away, and it is doing the same thing. But the tendon, which is the end of a muscle, is different than the plantar fascia, which is a ligament, which is a very tough tissue. The Achilles tendon is a very elastic band of tissue. But what's happening is as you are tearing it and it's lacking its blood flow, you begin to get what's called longitudinal tears. So you are micro-tearing the Achilles tendon, which can actually lead to a rupture, at which point the whole scenario changes. Because if you rupture it, then there is nothing else you can do but surgery to bring everything back down. So you got your plantar fasciitis, you got your Achilles tendonitis. You can try 80% of people, if you do your stretches, because in America, for some odd reason, about 80% of people will suffer from plantar fasciitis some point in their life. Whether it was only a few weeks 10 years ago, or it's constant, you're gonna have it. And it has to do with shoe gear. You're not wearing the right types of shoes, you're not stretching properly. People, I run 5 miles a day. Do you stretch before you run? No, I don't stretch before. Do you stretch after you run? No, I don't stretch. More than likely, you're causing all the damage to your tissue yourself. So, what do we do for it? Because when you come into the office and you have plantar fasciitis or Achilles tendonitis, don't treat the x-ray. And that's what a lot of doctors do, is you'll go in and they look at you and they go, oh, you have heel spurs. Let's get you into a $500 set of orthotics. Let's do steroid injections. We'll get you into some physical therapy. And we'll just keep trying stuff. External and internal band-aids is what I call them. It'll help a little bit. Nothing is going to break up that rust pocket. Nothing can break up that rust pocket. So everything you do, if you hear these Good Feet store commercials, oh my God, I went in there, these are like walking on clouds, my pain is gone. Do you know how many times over 27 years I've seen people bring in bags of crap that I've spent $2,000 on Good Feet, I've spent $1,500 over here, I've spent this. They work good for a while and then the pain comes back. I tell people I can stuff toilet paper in your shoes. It's gonna make you feel better for a while. Whether it's a day or a week, that pain's coming back because you're not addressing the problem, you're treating the symptoms. So when it comes to that band of tissue calcifying on the plantar fascia and the Achilles tendon, I believe in what's called high-intensity ultrasonic wave therapy. It's a way of basically fixing everything. But how do we get a proper diagnosis so that we know exactly what we're looking at? So the first thing we're going to do is we're going to get x-rays, because I want to see the size of those spurs, because that's going to tell me how long this has been going on for. So when you look at this spur right here, you go, yeah, that's about 7 to 10 years for that spur. This one over here, probably about the same, 7 to 10 years, just because of the size of the spur that we see. But that doesn't mean anything's going on. I can see those on people that say, I've never had any heel pain in my life. Well, good, leave it alone. Keep doing whatever it is you're doing. But what I like to do is what's called diagnostic ultrasound. Diagnostic ultrasound, this machine over here, is actually able to look at the band of tissue. So here, everybody see everything okay? So here, I'm looking at the bottom of the heel. So here, this line right here is the bottom of this heel right here. And this line right here, you can actually kind of see it, is the band of tissue. That's your plantar fascia. And here's how thick it is, which is a 3.9. And optimally, we want 4 or less, and I want nice lightish white gray. So when I look at that and I go, yeah, you're good. I mean, you're 3.9, you're lightish white gray, you have no pain even though you have heel spurs. You're doing good. Leave it alone, whatever you're doing. Go ahead to the next slide, please. So this is where I come in, regenerative medicine. I love Regen Med. Regen Med, again, is a way of keeping you off of drugs, out of surgery, on your feet, and get you pain-free. Our body is meant to repair itself. But it needs help. Sometimes it needs that signal, it needs that foreman on that job. We have stem cells in our body. And just like I tell people, whenever you're a guy and you're 18, 19 years old, your stem cell, you're done growing. So once you're done growing, your stem cells pretty much just go to sleep. Same thing with a woman. But if she gets pregnant, guess what? The stem cells come back awake. and they go to that fetus and they say, hey, we need to make this a viable fetus. Well, don't forget about my plantar fascia. Nah, I wasn't called there, so I'm not even gonna go there. I'm not even looking at it. So it has to sometimes be placed in that area. So with regenerative medicine, there are ways of just fixing it. Go ahead to the next slide, please. So the archaic way, I love it. It's the archaic way. It's what everybody is taught to do, is what's called an EPF. If you have failed every conservative option out there, you've done your stretching, your inserts, your physical therapy, your steroid injections, and they may even try PRP injections, amnio injections. That is all internal and external Band-Aids. They are not addressing the problem, which is what? You've been listening to me for a while. What is the problem? It's that calcified tissue. It's that band of tissue that's rusted that can't flex anymore because it has no blood flow. So if you don't address that, their option is go in there, make an incision on both sides of the heel, go in with the camera on one, a blade on the other, and we're going to release a portion of your foot's shock absorber to take that calcified tissue off of that nerve. Even 27 years ago when I was in my residency, I said, that's crazy. I said, you're releasing a portion of the foot's shock absorber. I wouldn't go out to my car, take a shock absorber out of my car and drive around with 3, would you? No, you could, but you're going to beat the heck out of that car. And they're like, well, there's nothing else we can do. And I was like, well, what about this high-intensity ultrasonic wave therapy? It was a machine that was created about 40 years ago to break up kidney stones and gallstones through focused high-intense waves, no more incisions. And then in 1998, the FDA approved it for plantar fasciitis, Achilles tendonitis, tennis elbow, a bunch of other things. And it was covered by insurance from 2000 to 2005. And the thing of it is it worked so well. I was one of the first residents trained on it in 1998 when the FDA approved it. And I saw the benefit of it right away. In one session, we are able to break up all of that calcification, restoring that flexibility, and at the same time, pound all those blood cells in. Like I tell my patients, if I look out over at that field over there, I'm basically rototilling, and I hate to lose my field. It looks like they sold it and they're gonna build something over there now. But I'm basically rototilling that field and planting that seed, which is what I'm doing when I do the ESWT. 16 weeks knee-high by July. 16 weeks, those little arterioles that infiltrated that band of tissue and restored it back to the way it was before you ever had any trauma, damage, or anything. You're walking on it the same day, you have it done on a Friday, you go back to work on a Monday. It is just a wonderful option. What's the next slide? I'm just going off the slides. This is the MediSpec machine that was FDA approved. It's the only FDA approved high-intensity ultrasonic wave therapy machine that's on the market today that can be utilized to break up all this calcification. If you have arthritis in your joints and it's small enough arthritis, you're able to break all of that up without surgery and break it up into dust particles that the body just resorbs and gets it out of there. What's our next slide? All right, so here's our diagnostic imaging. Once I decide, listen, your only option is either live with your pain, have surgery, or do high intensity, one session of high intensity ultrasonic wave therapy, then this is what, I wonder why that doesn't show up on the TV. All right, where's my red dot? So if you look, and look at how thick this one lady was, and her only option was surgery. This was funny because she's a judge in the area, and her only option was surgery. She had been messing around with a bunch of other doctors for like 3-4 years. And she goes, I can't have surgery. Here's the bottom of the hill right here. This is all her plantar fascia. So she's coming in at a 7.8. We want it to be 4 or less. And look at how black it is. So as I'm doing the procedure, which only takes about 15 to 18 minutes in the office to do under a local where I put the foot to sleep. You couldn't take one of those electrical shocks, let alone the 2,000 someone putting in there. But I'm using my diagnostic ultrasound as I'm doing it so that I'm able to keep looking for all these black spots to break everything up. Go to the next slide, please. So during the procedure, you can see these 2 little white lines right here. That is the shock wave that's pounding through that tissue. And as it's pounding through, it is breaking up all the calcification in here, and those little arterioles that were feeding that band and can't break through that M&M coating anymore, shunt off and go someplace else. But as that shock wave is coming through, it is pounding those little blood cells into that band of tissue. So go to the next one. So this, the blue, is actually the shock wave itself, and the red is blood. So we're breaking up all of that calcification and pounding the blood throughout that band, kind of like seeding the field. Go ahead to the next one. This is her right after one procedure. So there's the top of her heel. Here's her band of tissue now. Can you see that? So we're at a 4, and I want it to be 4 or less. And you see how light and whitish gray that is? That's the way that band of tissue should look before you ever had any trauma or damage to it. So having surgery, which is going to keep you down for 3 to 4 months on pain pills for 4 to 6 weeks. And I can tell you this from doing this 27 years. 30% of the people I treat are people that have already had the surgery that say the same thing. I'm still in as much pain, if not more now, and I just wasted 6 months of my life. It's because they didn't resolve the issue and tried to treat the symptom. So, go to the next one. All right, so this is basically what we're doing with the machine. After I numb up your foot with some lidocaine injections right here, we are putting it up against, my girlfriend wants royalties for using her foot. But the electrical shocks, and I can tell you, it hurts without having your foot numb, because I was a stupid resident 27 years ago and said, how bad does that hurt? And at the time, the machine was about 5-6 times the size of that. But the ball was the same size. And the guy says, well, put your hand on the end and I'll give you 1 shock on low. So he gives me 1 shock on low, and I was like, all right, I mean, I felt it. It wasn't too bad. I said, how's that going to break up all that calcification? He goes, oh, let me put some conducting jelly down. Now put your hand on it. He gave me 1 shock on low. I couldn't pull my hand away fast enough to see if I had a huge hole in my hand. And that was on low. So it definitely breaks everything up. Go ahead to the next one. So a lot of doctors around the United States love to push what's called radial ESWT. Radial ESWT is a good physical therapy option. But remember I told you 80% of people can be resolved with physical therapy, inserts, stretching. That's where that comes in. But it runs $150 a session. You should do 1 to 2 sessions a week for 5 to 10 weeks to help decrease your pain. I'm not looking to decrease your pain. I'm looking to resolve your pain. Go to the next slide. So basically the Achilles tendon is under the same aspect. That if you fail everything, and the options are so much less when it comes to Achilles tendonitis, you can't put steroid like you can for the plantar fascia, because that's a ligament. The Achilles tendon, you put steroid back there, it's like gambling in Vegas, because you got a 50-50 shot of whether or not you are going to weaken that band of tissue and cause it to spontaneously rupture. So if a doctor ever says, well, let me try giving you 1 shot of steroid back there, run away. I've been doing this 27 years, I can tell you, don't do steroid back there. You will weaken everything and cause the calcification to just hasten its arrival. So if you've tried the stretching and you've tried inserts, which are really the only 2 things, stretching, which is physical therapy, and inserts, and you still have Achilles tendonitis, they're going to tell you live with it or have surgery. And if you have surgery where you have a job where you're on your feet 8 hours a day, you're off work for 4 to 6 months per foot with a year of physical therapy or recovery afterwards. How many people do we do with Achilles tendonitis that'll say the same thing a week later? I'm like 80-90% better in 1 week. It's a 16-week healing process. You're going to hit that 100% mark. I'm 100% better. Keep doing my stretches that I show you. And even when you're 100% better, I tell them you should stretch it first thing in the morning, you should stretch it last thing at night, and 1 time at lunchtime. If you're going to do exercise, stretch it before you exercise, stretch it again after you exercise. Stretch, stretch, stretch. You ever see these little old ladies that walk all hunched over? It's because they work their entire life. They come home, they sit down on their lazy boy now that they're retired, watch TV all day, they don't use their muscles. As their muscles are relaxing, they're contracting. As they're contracting, they're getting that hunch. That's why old people say, I can't move, I'm so tight. You're tight because you're not moving and you're losing your flexibility. Stay flexible. I was in medical school. Quick little story. I was in medical school. I was on the 3rd floor. There was this elderly lady on the 2nd floor, but I would see her outside every day, 7:15 when I'd leave to go to work. Rain, hail, sleet, snow. This little old lady was out there just doing her Tai Chi every morning. And she lived with her son. And I asked her son one day, I said, man, your mom, she's a trooper. Rain, hail, sleet, snow. She's out there doing her Tai Chi. I I said, she keeps doing that, she's gonna live to be 100. He looks at me square in the eye and says, I hope so, it's only 2 years away. 98 years old, still doing Tai Chi every morning. Rain, hail, sleet, snow. I was like, holy crap. Stretch, stay active. That's why I say, they got a pool over there. That's the best thing you can do is swimming. It takes all the weight off of your joints. You're gonna fire all them muscles. You're gonna use those joints. But in cases of where, hey, time has taken its toll. That's why they call it wear and tear disease, arthritis. Time's taking its toll on our bodies. We all get arthritis. How bad does it get? You get to a point where you start doing steroid injections or synvisc injections, hyaluronic acid in your knee, which are all temporary internal band-aids. Or do you want something that just says, just fix it already? Either do surgery or you do regenerative medicine. Regenerative medicine, Wharton's jelly and exosomes, has been used for the last 30 years in Europe. We won't use it over here because, again, I told you it was covered from 2000 to 2005. But Blue Cross Blue Shield found something out in their infinite wisdom. Only 2 in 10 people were having the Achilles tendon surgery done because it's so disabling. The other 8 in 10 said, I'll just live with my pain. When they were covering high intensity ultrasonic wave therapy, 7 in 10 were having it done. So in 2005, Blue Cross Blue Shield said, we're losing too much money. We're going to term Regen Med experimental. We're not covering it anymore. We're just going to cover the surgery. It took about a year for all the other insurance companies to jump on board, and they said, well, Blue Cross Blue Shield's screwing everybody's sore away. At which time the hospital sent a letter out to all the doctors and said, nobody can use our machine. It's $1 million machine. It only covers kidney stones and gallstones, so going back to doing your archaic surgery. And that's when I bit the bullet and bought my first machine, because I said, that's crazy. I'm not doing surgery. I'm not doing surgery on that. There's no reason to. It's nuts. So there's options. There's options. You have knee pain, shoulder pain, rotator cuff tears. You got a 40% or less rotator cuff tear, 1 shot of exosomes is proven to repair that rotator cuff. There is no need for surgery. Arthritis, knee, I'm bone on bone. Calling Wharton's and exosomes both, 1 shot of each. See you in 6 weeks. And most people say the same thing. I'm 80, 90% better. I'm not using my knee brace anymore. I'm walking with my husband or my wife 1.5 miles, 2 miles every day again, instead of just making it down to the end of the driveway. So you have options. Any questions so far?
I'm a believer.
Should be a believer. I'm definitely a believer. I love what I do. I see the effects of what I do. The machine is good at what it does. I'm good at using that. And I have a 98% first-time treatment success rate, which I am very proud of. So.
You said 98% success rate. Does it come back later or not?
No, actually, when I was leaving St. Louis about a year and a half ago, I had a lady come in and she goes, hey, you remember me? And I was like, I don't remember you. She goes, I was your second patient here 10 years ago when you opened this practice. You did that shocky thing to my right foot. And I said, oh, is your pain coming back? She goes, no, I've never had another day problem with it. She goes, it's my left foot now. I need the shocky thing done on my left foot. I was like, well, I'm leaving to go home in a month, so, oh, you gotta do it. And I was like, I'll fit you in and do it. And then oddly enough, when we had a guy just a couple of weeks ago who said, yeah, I had it done 25 years ago. It's starting to come back a little bit now. I want to get that shock wave done again. So, long-lasting effects.
How does this compare to all those commercials you hear for QC Kinetics?
So here's the thing with Regen Med. 27 years ago, I love it. 27 years ago, when I was graduating and starting my residency, and I discovered what regenerative medicine was, and I just kept researching, just trying to learn as much as I could. My buddies were calling me crazy because I believed in regenerative medicine. And now when I moved back to town about a year and a half ago, they were like, Vinny, come join our practice, bring Regen Med here. I was like, I don't work for anybody. And weren't you guys the ones calling me the nut job 30 years ago? But QC Kinetics, 27 years ago, why everybody was calling me nut, is I was doing PRP injections, plasma-rich protein. You draw 60 cc's of blood out of somebody's body, spin it down, take the plasma portion, mix it with calcium, put it someplace. It helps to increase healing, decrease the inflammation. It's really good for wound care, is what they found out over the last 20 years. But the effects of PRP, which is what everybody who says they do Regen Med is doing now, is really good when you're in your 20s. When you hit about 30, the efficacy rate plummets. It doesn't scale like that. It just, Niagara Falls plummets. So if your doctor's telling you, listen, we're gonna do PRP, it's $750 to $1,000 injection, you're gonna need 3 injections, 2 to 4 weeks apart, and I'm probably gonna see you back every 1 to 2 years to redo that to help keep everything calmed down. That is what QC Kinetics and everybody else that says they do regenerative medicine is doing. I did that for about the first 7 years, 27 years ago. So I did that for about the first 7 years. And then amnio came out. And amnio, the effects of amniotic fluid, and no babies are hard with anything that I'm telling you about, but the effects of amniotic fluid, one shot of amnion is good for about 3 years. But you only need one. You don't have to do 3 PRPs and come back every 1 to 2 years. With amnion, you come back every 3. Glutathione, peptides, yada, 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 yada. We got to Wharton's jelly and exosomes, 2 of the king premier regenerative medicine options in today's market. And the difference between that is if you're bone on bone and I inject Wharton's and exosomes, you probably have 7 to 10 years before you need to redo that injection. I tell my ultra fit, Ironman, do I do Ironman contests? I'm probably going to see you back in 5 years, just because you do that. But for most of my patients, you're 70 years old, I hit both years, you're probably never going to see me again, other than a 6-week follow-up. So here's the difference between the top 2, Wharton's jelly and exosomes. Wharton's jelly was discovered about mid-1600s by Dr. Anybody? Wharton. And Dr. Wharton said, hey, there is a gelatinous substance on the inside of the umbilical cord that offers it its cushioning. I'm going to name it Wharton's jelly. Fast forward 300 years. What he didn't know was Wharton's jelly is filthy rich in growth factors and, more importantly, mesenchymal stem cells. Mesenchymal stem cells are our body's construction workers. And they are just healthy construction workers. You put them someplace, it can, like in the knee, it can resurface the cartilage, repair that meniscus and fluff it back up. So if people come in and I get x-rays of a knee and they have angulation, you'll see that angulation start correcting itself over a 6-month period. If they have a decrease in space, within about 3 months, you'll see it puffing back up because it is cushioning that entire knee joint and repairing everything over a 6 to 9 month period. Exosomes are the king premier. They're expensive, but they are the king premier. I tell people, if I was looking, I'm out the wrong window, but as I say, I tell my patients when I'm looking out the window, look at those houses over there. If I look at that one house and I say, hey, I either need to bulldoze that house to the ground or rebuild it, I can put my Wharton's jelly on it, come back 6 months from now, it'll be rebuilt brand new. If I come into the office one day and I go, holy crap, that building burned to the ground last night, I can put my exosomes on it. It knows the blueprint to come back in 6 months from now and it'll be rebuilt. That is the power of regenerative medicine. That is what I love to do because I love happy faces. Any other questions? Yes?
Sorry, did you say it is covered with insurance? Or?
Nothing I do is covered by insurance because it works.
That's right.
Nothing I do is covered because they refuse to pay for it. Again, we are an insurance-based, surgical-based society. So they have made some exceptions. Diabetics. If you have a diabetic ulcer, then they will cover Wharton's jelly because they found out that after you've tried all the tissue grafts, all the amniotic tissue grafts that you want, and you are still fighting that diabetic ulcer, and you're getting to a point where it looks like, you know what, we may have to amputate. That is when insurance will cover it and say, okay, we'll allow you one shot of the Wharton's to infiltrate around the wound, and you will just watch it. Weekly, they come in for debridements, and you just watch that wound close in about 2 months. So I've had people that they've been fighting with it for 2 years, and within 2 months, we get that closed. Now I don't do wounds anymore because I retired from surgery and wounds. I just specialize in regen med anymore. 27 years was enough. Plus I got a 2-year-old kid. I know.
Have you heard of prolotherapy?
Prolotherapy I have, and the problem with prolotherapy is it takes multiple injections. They do hurt whenever you get those injections. They will sting for a while. The effects as well are temporary. 6 months to a year after you go through the 3 or 4 or 5 injections. So, again, to me, it's just an internal Band-Aid. It works for some people. It's like I'm saying, that's why there are so many options out there. Everybody's different. And you may have said, oh, no, I don't, that guy's crazy. I got 2 shots of prolotherapy and I've been fine ever since. Thank God. Right? I look for the 20% that says, I have tried everything and I can't do a dang that thing and nobody knows what to do with me. Yes, I do.
So is part of the shock therapy also the other part too? I mean, like, if you do the shock therapy because you see what you saw, do you have to do the other medicine as well?
So yes
or are you
and no.
just doing-
So when it comes to the plantar fascia, again, that is a ligament. And the Achilles tendon is the end of a muscle. When it comes to the plantar fascia, you really don't require any type of regenerative medicine injection along with it. Usually 1 session of the high intensity ultrasonic wave therapy is enough to restore the flexibility and restore the life and the blood flow back to that band of tissue and basically resolve your heel pain. When it comes to the Achilles tendon, the end of a muscle is called a tendon. The tendon is what inserts into the bone. Anywhere in our body, those tendons have a beautiful insulation covering on them, so I can do my shock wave anywhere I want and get fantastic results. But when it comes to the Achilles tendon has what's called a peritoneum, a very viscous, watery layer type of insulation. And all the literature will back me up when I tell you that if you are destroying that tendon from the inside out, it is because you have destroyed the peritoneum, which is on the outside. So if you had surgery, after they take your Achilles tendon off, and they're gonna tell you that they're gonna take that spur off, which you don't need to, but they're gonna take that off anyway, and then they're gonna anchor it back down. Before they close it up, they're gonna wrap it with an amniotic tissue graft to restore that insulation. Well, once I do the shock wave, which breaks up all the calcification, restores the flexibility, restores the blood flow, we need to figure out how do we restore that peritoneum so that we're not drying from the outside in still. And that's where Wharton's jelly comes in. 1 shot, half of it up one side, half of it up the other side, will repair the entire peritoneum and restore up to 40% of the strength in the tissue. So when it comes to the Achilles tendon, I will not do one without the other. And I won't do one without the other. It's gotta be both. You do the shock wave first and then the Wharton's. And that will repair that entire tendon. And again, I've had people that I've had it done on both. I had a plumber who did both of his Achilles, had it done on a Friday, went back to work on a Monday. I saw him the following Thursday and he goes, yeah, I have like maybe 5% of the pain of what I used to have. I'm back to doing my ladders, crawling under the houses, doing everything I need to do. Best money I ever spent. And I love hearing people say that. I love keeping people out of surgery. Any other questions? Yeah.
So what's the success rate, can I say?
What is what?
Success rate? Like, success rate.
Oh, the success rate? I love my success rate. All the literature will say 92% success rate. I have about a 98% first time treatment success rate. All right, so what happens if I'm that 2%? I believe in what I do. So if you are that 2%, then if you're not better in 16 weeks, I'll repeat everything at no additional cost, at which time now you should be about 99.9% because I've never had to do it 3 times. So I tell people, I mean, you may just be that dang nab bad, but it's gonna take 2 treatments. But the second treatment is on me if you don't get to the first. But I have a 98% first time treatment success rate, and I love my success rate.
The graph you were talking about, you said you covered 40%, repair 40%, then eventually.
No, that 40%, it could repair up to 40%, it'll add up to 40% strength in that tendon. So because you are trying it out from the outside, it's starting to weaken. By us repairing that peritoneum, it is re-strengthening, putting that moisture back into that muscle and allowing it to re-heal itself.
Exercise will help you.
Yeah, stretching is a key. I tell everybody, if you don't stretch, you're not gonna get the results that everybody else is gonna get. You'll eventually get there, but I wanna see everybody get there quicker than later.
And you will point to the stretching, what type of stretching?
Oh yes, I have certain stretches for certain things that I do, that you need to do.
I guess there are no side effects or.
There are no side effects. That is the wonderful thing. Even with the regenerative medicine, good question. Even with the regenerative medicine options, exosomes, Wharton's jelly, and those are 2 of the favorites that I love. Because again, amnio, it's good, but it only lasts a few years. PRP, don't even use it anymore. It's just not, I mean, if we were all in our 20s, shoot up every sports person that there is. But even the sports people know, I don't want PRP, give me the Whartons or the exosomes, because it's just gonna be such longer lasting effects, and the repair is so much better. But this is stuff that's already in our body, and it doesn't know to go there and activate itself. These injections are the triggers that are causing our body to say, this is where I need to go, and this is what I need to do to fix it.
So what is the exosome again, one more time?
So exosomes are little vesicles that are spin-off of our body's natural stem cells, but they have a very special function. The exosomes are our body's communicator cells, messenger RNA. So whenever they go someplace, or wherever they are put someplace, the first thing they're gonna do, like if I put them into the knee, the first thing they're gonna do is call our body's natural stem cells to that area. And they're gonna say, okay, now that I got all my construction workers here, my stem cells, hold it, you guys are 40, 50, 60-year-old stem cells. I can't use any of you. So the first thing I'm gonna do is rejuvenate all of those stem cells back into the 17, 18, 19-year-old powerhouses that they once were. Then I'm gonna put them to work, which is why I tell people, once I inject you, you'll start feeling a difference in about 2 weeks. I'll see you in 6. That is the power of exosomes. That is why exosomes are the king premier to date. I've never heard anything yet, research-wise. And I love Regen Med, so I read everything I can.
What's the source of exosomes?
What's the what?
Where do you have the harvest them? The source.
The source?
Yeah.
Yeah.
So fetal tissue, but even like whenever my girlfriend and I, we were having our kid a couple of years ago, went to one hospital and St. Mary's, and they said, because I was in St. Louis, I said, who do we donate the tissue to? And they're like, oh no, we're a Catholic hospital, we don't do that. We throw it away. And I was like, oh, I'm Catholic too, but God gives us this stuff to use, and He gives us the brains to say, hey, there's a purpose for this, don't just throw it. Did you know that the placenta can be processed into enough skin grafts to cover 3 entire human burn victims from head to toe? So whenever a hospital says that they're just going to throw that away, it makes me sick to my gut. So we went across the street where I worked at the time at Missouri Baptist, and we had to go through all the genetic testing, which the tissue banks, 2 of the nation's largest federally regulated, FDA regulated tissue banks, they come in and do all the blood work so that you can get genetically cleared to be able to go ahead and donate the placenta and the umbilical cord. And that is where you get that from. So, but donate that stuff. Tell everybody to donate that stuff. I mean, just the skin grafts alone from the placenta is just amazing. And the stem cells that you get from the umbilical cord.
Quick question. For arthritis, you use shots or Regen Med?
Shots would be the Regen Med. So Regen Med, the only way to get that into an area would be through an injection. But it's one injection.
Shots?
The electric shock.
Oh, the electric shock?
For arthritis.
So yeah, if you have arthritis, and what I recommend is first off, you want to get x-rays, because we want to see a couple of things. If you have huge spurs, the last thing I want to do is a shock wave on you, because what if I break that spur off? Now it's floating around in the joint. Guess what? You just bought yourself a surgery, because nothing's going to get that out of there. If there's a cloudiness on the x-ray that shows me that it's arthritis, and there might be some minimal spurring at certain points, then yes, I'm able to go ahead and shock that into a point where it just shocks into obliteration. But then I would hit you with either the Whartons or the exosomes to resolve everything. Because the good thing is it can change out. As to where if you go and you get Synvisc injections or hyaluronic acid, coxcomb injections, steroid injections, that is like adding a good quart of oil to a bad oil case. Exosomes and Wharton's jelly, one injection over a 6-month period, will turn all that synovial fluid over and change it out from the old arthritic fluid into the new fluid that it should be. So yeah, arthritis, it's injection therapy. But it's one injection. That's what I love about it. Anything else?
Yes.
I got plenty of answers.
Well, this is gonna veer off a little bit, but it's still a foot. So all this that you're talking about sounds wonderful. So what if you have a
Okay, so that's not surgery. So first off, if you have a bunion, you are born with a bunion. You're born with that bunion deformity. Either mom or dad or grandma or grandpa have it because it's genetic. And you've had that bump on the side of your foot forever. And whenever you finally get to a point that you're like, crap, this thing hurts no matter what I do, it's because you have worn away all the fatty pad between the skin and the bone from just the constant rubbing up against the shoe over the last 40 years. So there's actually what's called Leniva injections. Leniva is FDA regulated, and it is the only thing on the market that can actually rebuild the fat pad in that area. One Leniva injection, so when people come in, and here's the bottom of your foot, and they have calluses underneath that are painful, and they say, my doctor wants to do metatarsal head resections, which is what you're gonna do. You wanna take the metatarsal heads off to relieve the pressure points. But you really wanna do that on an 80-some-year-old lady who's now gonna be down for 6 to 8 weeks? No, that's crazy. I tell them, do one Leniva injection, split it between those 3 calluses, and it's basically laying down a fat pad matrix that calls the body's natural fat to that area. And again, you will start seeing that within about 2 weeks, the pain is going away. Within 6 weeks, they come back and they're like, Doc, I got no more calluses under here. It's gonna last about 5 to 7 years. You're 81 years old, you're not jogging 5 miles a day, it's gonna last you the rest of your life. So same thing with the bunion. You run a Leniva injection up along the side, you give it 6 weeks. I tell people it's best to do that in the summer when you can wear flip-flops, so you're keeping the pressure off of that and allowing that matrix to just form and repuff everything back up in that area.
Will
Same
it
thing with hammer toes.
straighten any, or will you always still?
What's that?
Will it straighten?
Now, the only way to straighten that is, guess what?
Surgery.
Surgery. The only way to
But
straighten that is
pain
the
will-
pain will go away. You've had that deformity for 40 years, or however old you are, but you've just gotten to the point where you just wore away the fat pad, now all you have is bone, nerve, and skin, and that's why it's irritated with everything that it touches. So where some doctors want to go in and do what's called a neurectomy, where it's going to make a little stab incision and cut your nerve. Don't do that.
What's the price range for like a heel pain once done?
So Shockwave itself, the high intensity ultrasonic wave therapy starts at $2,400. It's a one-time deal. It's worth it. Again, I look for the 20%. 20% of people that have tried everything and have no other option other than live with it or have surgery. And luckily, the machine's not $1 million anymore. It's only about $250,000, so that's always a plus. That first one set me back.
Give me discounts for multiple issues.
Yep, we did. Because I don't look to.
More serious, because.
I don't like to rake you over the coals. There's a lot of people that come in and need bilateral knee injections. Or there's a lot of people that come in and go, look, I had a left knee total replacement and it still hurts. Okay, well you had a total replacement, so you only need Wharton's. But I'm not having anybody touch my right knee and it's bone on bone. Well, you're gonna need Wharton's and exosomes to rebuild everything. So, I mean, as the price keeps jumping up, then discounts start hitting in. We don't wanna, I don't rip people off. I like to offer my services to try to fix everybody, because what I'm gonna ask you to do afterwards is refer me somebody.
Does the exosomes or what was the other Wharton's gel? Is it acceptable for most generic population or
Yes.
people reject it?
No,
People reject
you're not gonna
because
reject
it's
it.
different.
So of all the studies that have been in there, the only complication that they can find over the last 30 years with Wharton's jelly or exosomes is injection site infection, which is a rarity. I don't think I've had one in 20 years.
So even for older people, they would.
Oh, it
still
works
regenerate?
perfect for older people.
They can regenerate?
Yep, it'll resurface that cartilage, repair that meniscus. More importantly, it's gonna take you out of your pain.
Yeah, I was thinking about my mom. She did a knee replacement on
Yeah.
one. She didn't do the other, and they're both bothering her.
Yeah, and the thing of it is when you've already had a total, like I tell you, you just need the Whartons. The Whartons will repair all the arthritic capsule, the synovial fluid,
Even
the
after the
ligaments.
surgery?
Even though she already had the surgery, she's still a candidate to get out of pain.
Get out.
Yes, with one injection. If she's bone on the other, she would require Whartons and exosomes. They are not cheap, folks, so, I mean, Again, I'm one of 12 in the United States that does what I do. Exosomes, to be honest with you, are 7,000 for one injection. One injection. But it's the difference between needing surgery and having pain, or not having any more pain and not needing surgery. Wharton's jelly is $3,500 for one injection. But everybody says the same thing. It was expensive, but it's the best money I ever spent.
How do you spell Wharton?
Whartons. Go to my website and read all about it. I put all of my regenerative medicine on there. So you just look under the Regen Med title, click down, and you can go right to where it says exosomes, Wharton's jelly, amnion, Leneva. I don't do PRP though. It's junk. It was good 27 years ago because that's all I had. That's all I had was PRP 27 years ago. That and my shockwave. And then again, amnio came out, so I just stopped using PRP.
So you have 1 or 12, is it because of regulation, or is it because?
It's because we are an insurance-based, surgical-based society. And doctors they're not trained in regenerative medicine. There was no schooling on Regen Med. And that's why I say, whenever I started getting into regenerative medicine 27 years ago when I was still in school, my friends were like, that's crazy, what are you talking about? Do surgery, fix that thing. You don't have to do surgery, I tell them. That's nuts. You don't have to cut everybody open. You can fix people without cutting people open.
Do you have colleagues or cohorts practicing in like Europe or Asia with the same strategies?
I do,
Okay.
I do.
So for Achilles, you said that we need the shock wave and also the injections, right? For the
Yes, for Achilles tendonitis, I will not do one without the other. It's shockwave with a Wharton's jelly injection.
So shock wave is 2,100, how much is
The Wharton's jelly is 3,500. So it's 59 for an Achilles tendon. But you will have it done on a Friday and you will say the same thing on Monday. Holy crap, I have no pain.
So that includes both injections and
Yeah, it's one injection that I split, half of it run up each side. And that repairs the entire paratendon.
So if we came to see you then, and you were able to diagnose both by looking at, through ultrasound and through x-rays, like the Achilles and the plantar fascia,
Yeah.
to see where we're at with it?
Right.
They have actually MRIs and, the whole 9 yards of it.
But bring your MRIs. I love reading MRIs. They always said I should have been a radiologist when I was in my radiology. They're like, oh my God, you can read these. I love reading MRIs and CAT scans. I just gotta sit in a dark room all day long. I told them it's just nuts. Again, it's not for me.
Just curious, because that's the hardest part, is knowing that what you're putting, I hear what you're saying, but
Yeah.
at the same time, how do you afford both feet, both Achilles, both plantar fascia,
Well, if you have Achilles tendonitis and plantar fasciitis, I just do them both at the same time.
it's all,
No, that's all in one price. So that would be like I was just doing the Achilles, but I'm throwing in the plantar fasciitis because it's connected.
let me just tell you, it's been a long road.
Well, this road can come to an end. Your road to recovery starts here, is what I tell people. I just had a lady, last week from Montana. She found me on a heel pain blog that I did one patient who was the same way. It was 3 years of just 9 doctors, no relief whatsoever. Came to me, found me on TikTok, came in, we did her, and she was like, holy crap, within 6 or 8 weeks, she's like, I'm pain free. I can't believe it. I'm going on I have 2,000 people on this Facebook heel pain blog. And so she told everybody, stop doing this radial, stop doing all this crap, go see this guy. A lady in Montana called in and said, I need to come, I need to have both of my heels done. I've already had surgery on one, I'm not having the other one. They've tried PRP, they've tried amnio, they tried steroid injections, radial ESWT, E-stim, nothing is helping. It's been 3 years of misery, and I have a 3-year-old and a 1-year-old, and I can't chase after her. We just did her, last week, and already she's like, it's sore from the injections, but I'm already feeling better. And you're just gonna keep getting better. You can't help it. When I showed her the before, durings, and after of my diagnostic ultrasound pics as we're doing it, a blind man could see how black it was and now how gray it was. It's instantaneous results. That's why I'm always tweaking the foot and telling people, don't help me. Let me have your foot, because I'm gonna be tweaking it up and down and side by side as I'm using my diagnostic ultrasound, because I'm looking for those black spots. I wanna break up all of those black spots and make sure that band of tissue is nice and gray and thin. And once I feel, it's usually 1,800 to 2,100 shocks. Some people will take more, some people take less. If you're older, kind of take less.
Well, I thought it was interesting what you were saying, because I have the Baxter, I had a gentleman that did PRP, not on me. But I went in to ask about it because I've been in this pain for, almost coming on 9 months. And so I said, well, he said, oh no, most patients it's Baxter's nerve entrapment. So that's when he said he was gonna inject my Baxter's nerve,
Yeah.
which he did do,
Okay.
and he didn't do anything.
And that's
I
because
was
it's-
really sad because I was like, oh yeah, you got it.
Because you thought it was going to.
Yes, so hopeful, right? Because no one else.
Yeah, if you don't break up that, you are chasing the problem. And again, they don't have a way of breaking that up if they don't have this machine. And they can't afford that machine, because it's like this, you can't buy just one. You base your whole practice off of one concept, you can't buy just one machine. When that machine shits the bed, you need two. So, to start a regular podiatry practice, 175 grand. To start what I'm doing, 750. So, they don't come out going, oh, I'm gonna do that. Yeah,
So, this is gonna sound silly.
no silly questions.
So you get whatever the procedure is,
Yeah.
that's what you call it? Shockwave. Yeah, shockwave. For the multi-sport people that you probably have worked with, how long does it take them to kind of get back into?
So when I first opened this up, November of 22, one of my first shock waves was first week of December, and it was a guy who called from Cincinnati. And he goes, I'm wondering if this procedure could help me because they want me to have surgery and they told me I'm gonna be down for 3 months. He goes, I played professional ball. Is this an option for me? Because it doesn't have any drugs that they're gonna test. And I was like, there's no drugs, no nothing. If you just have plantar fasciitis. I said, come on up, we'll take a look at you and we can do a consult procedure the same day if that's the case. So I came in on a Saturday for him, and it turns out he was a player for the Cincinnati Reds. And so I did him on a Saturday, and he called me on Tuesday and said, I'm back to running the bases. And he goes, the guys are like, what the hell happened to you? He goes, we thought you had to have surgery. It's like, I'm gonna go see this guy. He referred me 2 other guys, one with Achilles, who was gonna be down for 6 months because of his Achilles. Within 1 week, he was back to doing everything that he was doing. So, I love my results.
Do you do hands or just?
I do.
Okay.
I do everything but the head, neck, back, and hips.
Okay.
What about shoulder?
Yep. Everything but the head, neck, back, and hips. I'm training an anesthesiologist right now. I'm trying to teach him what Regen Med is. And
Why not the head, neck? Is because
I just prefer not to.
Because of the nerve set?
Well, I just prefer not to. It's out of my comfort zone, let's say. So I'm talking with an anesthesiologist right now, and I'm trying to teach him what regenerative medicine is all about. And because I want to have him come in 1 day a week to do my head, neck, back, and hips on patients. Because there's a lot of patients that have hip problems, and you don't need a hip replacement. You can do exosomes or Wharton, same thing on a hip, just like a knee, just like an elbow. People come in and say, I have tennis elbow. You don't need surgery, you don't need to live with that. One shot of Wharton's inside that area. Within 1 to 2 weeks, you're better, and it's long-lasting effects. But I just prefer not to. It's out of my comfort zone. I didn't do that. You have TMJ, where you got that constant clicking thing right here. 1 shot of exosomes can repair that. You think they'd allow that? No. Live with it or do surgery. I had dental surgery, they tell you.
Curious question, in the decalcification from the electric shocks?
Yes. Where does it go?
Where is it going to be toxic to the rest of the body?
No, it is not. So basically, as we're breaking up all of that calcification, it's breaking it up into microscopic pieces, in which time the body's lymphatic system will pick it up, just like breaking up a kidney stones or gallstone, and excrete it.
Through urination?
Yep. Yeah.
Is there a way to differentiate Achilles and plantar, or
Is there a way to differentiate what?
in terms of symptoms or pain, what a person can get,
How do they say if it is?
If it is
plantar?
Achilles versus plantar fasciitis.
Yeah, that's where I do the workup. We'll check and see if you're asking, how do I know that it's Achilles and plantar?
Exactly.
Yeah, I mean, first off, you're gonna say it hurts back here or it hurts under here. All right, and I'm gonna press, and you're gonna go, yep, that's the spot, how'd you know? Because I've been doing this 27 years, that's how I know. But then I'm gonna use the diagnostic ultrasound, and we're actually gonna be able to visualize that tissue and show you, this is what it should look like, this is what yours looks like. If I press right here on that black spot, yeah, yes. So we know how to diagnose between back of the heel pain and bottom of the heel pain.
So if you have low level pain, can you massage it off? Could you, I mean, do you wait till it's really excruciating pain or low level pain? You do the procedure or?
So that all
low
depends
level?
on you. I mean, if you don't mind living with, my pain's only a 2 or 3, but it's a constant 2 or 3 for the last 2 years. Okay, you wanna live with it, live with it. You don't wanna live with it, come on in, we'll take a look at it and give you some options as to what I think can fix it. I don't like pain. You like pain?
I don't like pain.
You love pain?
No.
No. Yeah, I don't like pain. You wanna get out of pain? We got the options.
But for prevention purpose, let's say you don't have the pain, what would you do?
Good, no.
What would you do to,
Nothing, I tell you,
prevent
stretch,
calcification?
stay active, stretch, keep moving.
That is a prevention from
Yes.
calcification?
Yes, as we tighten up and we don't stretch properly, that calcification gets worse. So if I just sat around, here, I have a rusty nut and bolt, and I say, how am I gonna make this rusty nut and bolt brand new again? Oh, I know, I'll set it down right here outside, and I'll come back 6 weeks from now. I won't touch it. You think it's gonna be better or worse?
Worse.
It's gonna be worse. It's the same thing. If you're not resting, or if you're not doing something, you're just sitting around all day long, it's gonna get worse. Get up, move around, flex, stretch, swim, walk, exercise, stay active, do something. You sit around, you're gonna get old. Like I told my dad when he retired, if you plan on just coming home after 45 years of work and sitting in that lazy boy, just pay for your casket now, because that's what's gonna happen. I said, find a hobby, go do something, stay active. And he loves woodworking, so. we're not-
Anything like overstretching? Yeah,
So
walking
anybody, yeah,
2 hours.
you can overstretch. There's no need to overstretch. Even when I tell people, here, do my stretches before you go out and run, and then do my stretch. It's only 30 seconds per foot before you run, 30 seconds per foot after you run. I tell my desk jockeys, there's no reason to sit down at your desk for 8 hours a day. Get up every hour, do my wall stretch, 30 seconds per foot. Go sit back down and get back on your phone. Get up, do something. Don't just sit there and get old and get tight.
So what's the referral thing?
What's the what?
Referral thing? Do you give incentives for referral?
Definitely some.
What's the referral thing?
Like, you said something about like if you refer people.
Oh no, I'm gonna ask you to refer people.
Oh, okay.
I'm gonna ask
Is there a
you.
bonus
You know why?
for that?
Because you're gonna be so happy that you're out of pain
You're gonna refer.
that you're gonna refer me somebody. Because 30% of my practice is referrals from other people that have already had stuff done.
Sure.
Yeah. Because when I was in St. Louis for the last 10 years, I was doing 1,000 of these a year. And it's only because I couldn't do any more.
Okay.
So. Any other questions?
Yeah, well, you moved back here then.
What made you move back?
Yeah.
Well, you missed the original story. My parents, I always told my parents I'd move home one day. They're in their 80s, need a little help, and they weren't moving their butts out to St. Louis. So I picked the family up and said, we're moving here. So I bought a house 4 streets from them. That way I'm
Where do you
37
live in
seconds
St.
away.
Louis?
Chesterfield.
Oh my gosh, my girlfriend lives there.
Yeah,
That's so funny.
I love Chesterfield.
She just moved there from here.
Oh, really?
And you moved back.
Well, we keep the population working out there.
Apparently.
All right, well, I want to thank everybody for coming.
Thank you.
We're on the 3rd floor, Mid-Ohio Foot and Ankle. If you have any questions, grab our sheets over there. It has a lot of the information that I just talked about. And if you want, we send out informative emails every 4 weeks. You can leave your name and email address there. And Alec will be more than happy to send you informative emails on whatever type of pain I decide to talk about that week.
Thank you.
Thank you.
All right?
Thank you.
You're welcome. You guys have a great day.
Well, we've got about 3 cases in my house that we could do: knee, foot, bunion foot.
Yeah, I got a 2-year-old, so head, shoulders, knees and toes, knees and toes.
Yeah, we could definitely do that.
Can I ask you a
Yeah.
question?
Yes.
So, I kind of looked this up myself. Like, I think I have plantar fascia.
Okay.
But when I actually flex my foot,
Mhm.
stuff, it kind of hurts back here.
Yeah, it's the Achilles tendonitis back
But
there.
when I get out of bed, it
Yeah.
kind of.
You feeling it on the bottom? So you're actually kind of getting it from both because it's got to stretch from someplace. And if it's calcified on one, it's going to overstretch on the other and you're going to start micro tearing. So that would be a good case where we put diagnostic ultrasound on it in order to figure out where's the problem coming from.
Yeah,
You want a
yeah.
proper diagnosis first before you just go and start doing stuff.
We're gonna make an appointment.
But when I got